Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates.
Now let's look into the factors affecting the heart rate. So first is the heart rate is accelerated by. What is it accelerated and slowed by? So let's look at what is it accelerated. Heart rate is accelerated by the decrease in activity of the arterial baroreceptors. So decreased activity. Arterial baroreceptors. And then there's an increase in activity of the decrease in activity of the arterial baroreceptors and increase in activity of the atrial stretch receptors. So increased activity of the atrial stretch receptors. Next is it includes inspiration, there is excitement, anger, pain and hypoxia, exercise, as well as the thyroid hormone and the fever. So all this, it contributes to the increase in the heart rate. Next is where is the heart rate slowed. The slowing of the heart rate is found in the increased activity of the arterial baroreceptors. So decreased activity decreases the heart rate, increased activity of the arterial baroreceptors. So what activity is it? It is increased activity. Next, in case of expiration. In case of expiration, the heart rate is slowed. Then in place of grief, it is slowed, and in a stimulation of fibers, pain fibers in the trigeminal nerve. Next, also an increased intracranial pressure.
To learn and grow daily like this, please do subscribe.